Hello, everyone. My name is Chantal, and for my final presentation speech, I will be discussing nursing and self-care. More specifically, I will be talking about the issue about nurses and the lack of self-care in the nursing field. I have been taking this public speaking course for the past 6 weeks in order for me to complete one of few prerequisites in order for me to enter into a master's program into nursing. In doing this assignment, I have learned so much about the field of healthcare and nursing that I hope you enjoy it and get to learn something interesting. I would like to start my presentation with this quote by Leslie Gobel. And basically, if you're unable to take care of yourself, you're not able to take care of others. It's that simple, in theory. The photo on your left is an empty mug of coffee, coffee meaning the top choice beverage for healthcare professionals. Yay! And it's no secret that nurses are superheroes. They're the most caring people who put all their care in a patient, but they sacrifice so much of themselves. And we never hear that they are stressed, exhausted emotionally, physically, and mentally due to a variety of reasons. And COVID-19 has definitely exacerbated this issue and the issues that have been around healthcare and nursing for a very long time. Just as a roadmap, we will be discussing the history of nursing, self-care in nursing, solutions, and closing remarks. When it comes to the history of nursing, most people tend to associate this with Florence Nightingale. And she was known to be the lady with the lamp, hence the lamp icon. During the Crimean War, she was always checking on her injured soldiers at night, monitoring their progress. She became an influential figure in nursing for a lot of things. One is that she had a strong belief in providing a clean environment and cleaning everything that was used as it would improve the survival rates of wounded soldiers. And this hypothesis was tested and it worked. And she invested her own money in Turkish towels, soap, surgical tools, nutritious foods, and anything else that she believed could contribute to the positive outcome of recovery for her patients. She demonstrated the ability to organize, get stuff done, train other women at the time to do the same nurse duties she did, emphasizing sanitation, and she made nursing a profession in which later became highly respectable. Although the nursing profession has been around for a very long time, an issue needs to be brought to its attention as it hinders patient care, but also threatens the health of nurses, which is the lack of self-care. And the quote on your screen by the American Nurses Association Code of Ethics for Nurses, it basically states that the same kind of care that they provide to patients in regards to health and safety and well-being, nurses also need to give that same exact care back to themselves, or else they wouldn't be able to perform their job. Self-care is what leads to better patient care, and for a variety of reasons, nurses simply do not take the time to recharge. This is especially true during the time of COVID, where hospitals, including healthcare workers, are being pushed at their maximum in being able to care for patients. And 68% of surveyed nurses have admitted to putting patients' health, safety, and wellness before their own. And in nursing school, they are taught to be selfless and taking care of the patient as a priority. And when self-care is not practiced enough, they are increasing their chances for exhaustion, moral distress, PTSD, suicide, along with other health conditions that can appear later on. Because lack of self-care is a significant problem in nursing and is part of the American Nurses Association Code of Ethics for Nurses, I came up with a couple solutions that may help alleviate this problem. One would be nursing programs emphasizing self-care, perhaps a mandatory course that students may need to take. Having meditation rooms, some newer hospitals or bigger hospitals have such rooms that promote self-care. Having individualized consultations for self-care for current nurses as well as nursing students. Um, Self-care is different for everyone, and it's a good place to start to figure out what can work for the individual and what doesn't work. Hire nursing coaches. Basically, I kind of wonder if there was someone who was a life coach that coaches you through life, and someone who has nursing experience, who understands the stressors of nursing. So nurse coaches, I think it's a good thing to try. And nurse coaches could be very helpful in promoting self-care along with just someone who's simply there to listen. And and lastly, to have hospitals invest in relaxation apps to put on their phones. So even if you only have like 2 to 3 minutes or even 5 minutes, I think it's just better than nothing. Nurses are amazing at what they do, and they play a significant role in providing the best patient care possible. Nurses sacrifice so much of themselves, just like superheroes, in caring for their patients, that same care should be given back to themselves. Hopefully, somewhere down the road, there can be a variety of solutions to try and improvements to promote self-care in nursing and to change the mentality from sacrificing one's health to nourishing it. Thanks for listening.